Now let's get the show started. The federal government has refuted the news making the round that another lockdown is imminent due to the rise in the cases of coronavirus. During the week, the federal government also announced Monday, January the 18th, which is 2 days' time, as the resumption date for schools in the country after an earlier announcement that the resumption date would be reviewed. The question is, how safe are we with the resurgence of the second wave of the virus? And after that, I put a huge question mark. Now, to look at that with us this morning, it's my pleasure to welcome two gentlemen who are with us in the studio this morning and one who will be joining us via Zoom from London. We have in the studio Mr. Chuks Nwoko, social entrepreneur. Good morning.
Thank you for having me.
We also have the Secretary of the Nigerian Academy of Science, stroke public health physicians, Dr. Doyin Odubanjo. Good morning.
Good morning. Thank you.
And joining us via Zoom is Mr. Annie Bassi Ayo, who's co-founder Axiom Learning Solutions. Good morning, Annie.
Good morning,
to see you again.
Alero. How are you? Thank you, Alero.
Now, let me begin with you, Dr. Odubanjo. In spite of the rising numbers, there hasn't been a lockdown. Why do you think this is so?
Well, let's be a bit gracious to those who have to make these decisions.
Okay.
In understanding that there are no easy answers, to some of the things they have to answer for. We have a pandemic which people are focusing on, which is the virus. But several pandemics come with it. There is the fear, there is socio-economic challenges.
Oh, the fear is also a pandemic.
It's a pandemic. People are scared stiff. So there are all kinds of things that it brings along with it, in so much that it makes it a very complex thing to deal with. So when you look at it and you say, oh, yes, we are having this upsurge in cases, I avoid the term second wave. But when you say there's this upsurge in cases, why don't we lock down? The question is, can we afford to lock down, actually? When we did have the first lockdown, we saw what happened even in Lagos. Yeah. We saw how people became scared even in their houses, that they might be invaded. We saw all kinds of things, insecurity, violence, domestic violence on the rise. So there are things that come along with it. So the real question then will be, can you afford it? Can you afford another one? Let me also at this point say that a lockdown is an extreme measure and an unusual measure to use in the control of an epidemic like this. You want to actually control behavior. You want to do other things like being able to diagnose rapidly and being able to treat effectively. A lockdown is an extreme one, which you don't want to use too often or for too long because of the problems that will come along with it.
When you say we have this, when you list the second pandemic as fear,
right,
would you say it is as pervasive as the one that we know, given the fact that people are not complying with the simple protocols that you all have been recommending?
It actually is probably as pervasive, because when you watch what people are doing or are willing to do, how if today, for instance, we tweet right here and we put it out and say, oh, if only you would take 50 tablets of paracetamol, you will never catch COVID-19. You'll be shocked at how many people will take 50 tablets before we're done with this show.
True.
That is fear. That's the power of fear. That's what it makes people do. And globally, if you watch what people are willing to accept, what they're willing to give up, liberties and all of that, it's also fair sometimes when you look at what is going on.
Quick opening, Mr. Nwoko. What do you think of what he said? We have just 30 seconds before we take a break.
It's absolutely correct. I am more interested in the characteristics of what he mentioned, which is fear. It's very destructive. And you know that the economics, the politics, the economy, the destruction that has come with it has also led to fear in the economic sector, business owners, entrepreneurs like us, and in the homes, when you're not able to put food on the table. So the fear in itself, like you mentioned, is major. And that's what precedes every war.
I still have questions about that fear. but I think we should take a break.
After this break. Welcome back. Now, let me go to Mr. Bassi Ayo. Schools are resuming on Monday. What are your thoughts about that? In light of what is going on right now, schools are going to reopen.
Okay, so before I just answer that, I just want to agree with the co-panelists. This is a pandemic, and very often we are looking at just the health issues. We're looking at numbers, we're looking at indices that sort of always look back at health. There is a health issue. And when we say health issue, it's not just the virus itself. There's a mental health issue, which I guess when we mention fear, is also surmised within that. Then we have a learning crisis, and I think that's what you just alluded to in your question, which I'm going to address. And lastly, we have an economic issue. We cannot discuss learning on its own, neither can we discuss economic or health on its own. We need to look at it as an interplay of factors. Schools are opening on Monday, and I must commend the federal government and various state governments on their efforts in trying to surmount the issue. However, we are not yet there. The PTF has done a lot of work, but we're still not there. And when you look at some of the protocols that have been outlined, you ask yourself that are these protocols affordable and available in a rural, a low income, and a poorer neighborhood schools? They simply are not there. How many schools have a health facility? How many schools a functional health facility? How many schools have trained personnel? How many children in low neighborhoods even have access to clean water to have their bath, first of all, talk less of constantly washing their hands in schools? So I think the answer is that we do have a learning crisis, and it's where we are, it's a reality. And learning is not just about education in classrooms. Learning goes far beyond the classroom. The whole learning ecosystem involves assessment, involves learning, and certain other things. I think what is very important at this point is that when we say schools should resume on Monday, we should also sort of provide caveats that where schools are unable, where community, state government, local government are unable to open schools on certain days, what are the alternatives that you provide? We said a lot about online learning, which is fantastic, but the question is how many people have access to online learning? So I think, yes, schools have opened, and if you look at even the private schools, everybody's not going back to school because it's clear that the guideline says we should, schools must not operate at full capacity. Now, I want to look at the government schools, for instance. If you had a class of 70 people, you already had an overcrowded classroom, which we know in many instances is a reality of the day. We're not just talking about Lagos, we're talking about an entire country of roughly over 100 and something million people. So do we have the capacity to see, we will send 2 teachers to teach under the 3 climatic conditions? Do we even have enough teaching personnel? So I think we need to really understand that we cannot take a one-size approach. We need to embed and strengthen our school systems. That's the teachers, the leadership, the commissioners, the student heads, so that they can have a varied approach. Online learning must continue on TV and radio to support whatever learning will be able to occur in the classrooms. But coming back to the health issue, UNICEF just said that children are not drivers of the virus. I beg to differ. I'm not a scientist. I beg to differ in the sense that there has been so much research on the health impacts of the pandemic that we are not really sure where things stand, and things have not been fully verified. The WHO and authorities would say one thing, and months later they change. So we are in a place where we cannot go by what is issued. We must develop sustainable local solutions. So in a place like Lagos State, a school in Ekwe may decide to do it differently. They may decide that they have 2 schools a day, morning and afternoon shift. We need to also build capacity for the parents so that they can take sort of conduct some learning at home with their children. I'm not talking really about the middle to upper class children because they have access. I'm really talking about the lower income children because they are the ones that we're likely to leave behind. Now, when you said schools open, I just wanted to bring somebody else to the equation, the NYC camps, which I just read Punch this morning, that they've been redirected to start orientation. I think that is quite a cause of concern because we need to reduce the gathering. The gathering is what really we need to reduce. I mean, we need to resume some sort of normal life, but we must ensure we don't gather. I listened to what the panelists said. How many people in Nigeria? I mean, I just left out a few days ago. How many people are actually observing the protocols? How much more children? How much more young adults? So I think we need to face reality.
I think that's where the issue really is, why a good number of people are actually quite concerned. But let me bring that conversation back into the studio. Mr. Nwoko, you began by, talking the other time about this, the fear angle, the fear ambit, and he has also mentioned that, if we look at the mental health aspect, it is quite significant. But, looking at the social, the entrepreneurial aspect of it, a very good number of schools are private schools. Mm-hmm. A significant number of those schools have had very limited capacity before the pandemic. Mm-hmm. And now we are returning to school. What are your fears, if I can go back there, and what do you think we should be doing? Because it is also part of the responsibility of government to compel the schools to enforce the observation of those protocols.
I think at the point where we are, it will not be proper for me to use the word compel. I think that government should be able to reach out to its citizens by saying something like, look, do what you need to do to protect yourself. Do what you need to do to stay alive. Because as an entrepreneur, and coming to this place this morning, as I was coming, the question that was on top of my mind was, what is it that is really killing people? Because people are dying. What is it that what we don't know is killing us? We know about COVID. So when we opened this discussion, the first thing he mentioned was fear. And I have always talked about fear in my articles and all the things, other places I've spoken at. I've talked about fear. Now, as an adult and as a family man, I have developed my own local system of dealing with fear. But for the purpose of this discussion and for people who are listening to us, is it that beyond COVID, is it fear that is killing us and all that? Capacity, yes. If school is opening on Monday, how is government helping? I believe that government can help by just mere speaking. Like I've seen other heads of government speak to the people. Words of encouragement. Professionals like this, seek their opinion, see what you can get. Because there are just so many opinions. So I'm concerned, there's so many views, many opinions and all that. And as far as I'm concerned, in the month of December, I almost died of fear. I almost died of fear, and as a result, I had this contraction. In fact, I forgot it in the car. I brought what was used for me in the clinic where I had a contraction of the heart. I stopped breathing. I used Bitac. I used everything in wanting to start. Like when I couldn't deal with it anymore, I was taken to the hospital. Now, I spent about 6-7 hours, then came back home. How many people were that fortunate? Now, I think that we need government, not just in providing money or in receiving money, but what are you saying to the population? You got to constantly speak to us because right here we are speaking. Everyone. And maybe somebody can pick up one thing here and be able to get out of an ugly situation. But it's government's duty to constantly speak to us. Maybe say something like, do what you need to start, like open your schools, because this disruption, if we do not take care, is going to ruin our economy. That's if our economy is not already ruined. Mm. It's going to ruin our economy. It's going to disrupt the education of our children, like the man who spoke to us from London. the politics is going to be ruined. So if you do not have that leadership come to us by constantly speaking to us either in the mornings or in the evenings, saying something to encourage the population, we are not going to make headway. We'll just be all talk.
During the break, we were talking about masks. Masks seem pretty basic. And if I remember correctly, I think it was Cross River State government that opened a mask factory. If government were to give people masks, do you think they will not wear them? Because like you say, one cloth mask is about 400 or 500 naira.
Right.
Some sell for as much as 2,000 naira.
Absolutely.
And the disposable ones are about 100 naira each. But you're not going to advise the man who is selling meat in the market to use 100 naira use, and by the end of the day, he throws it in the trash.
Or in about 2 or 3 hours.
So if masks were supplied,
Right.
do you think people would behave better and actually use them?
Okay, so I think you've touched on the key issue, which is what we need is to have behavioral change, in general. Wearing a mask is not normal. It's not a natural way of life.
True.
Me walking in here and not shaking your hands is not normal. Not walking in there and hugging everybody I see is not normal, and trying to keep away from you. That's not normal life. So we're asking people to behave abnormally,
True.
so to speak. And the only way they can do that, and I think like Mr. Bassi was also saying earlier, the only way you can do that, get the sustainable change, is information, which is what he was just saying now. Yeah, is information. You need to talk to people, and you need to do it repeatedly. Now, you say, well, that is happening. No, it's not happening. What we have tried to use largely, I think, has been a lot more of fear and a lot more of fiat. We give orders. We will threaten you. We will, tell you will die. And as he spoke just now, what I was thinking about is the term for that in my mind is what you call positive reinforcement. You need to come to people's sides and talk to them. Explain things to them. This is what is going on. This is how this thing works. This is how this is transmitted. And now we want to ask you. So if you now bring the mask, for instance, I fully understand. It's a lot of work. It's by no means an easy task. And while we sit here on Sunrise, we're talking to just a small percentage of people, not to run down Sunrise, but there are a lot of people who are already by the roadside selling stuff. They're not watching us and all of that. So this is a lot of engagement that needs to be done, that you need to get down and engage with the people, explain to them. Actually, it comes to my mind, also just as he was speaking, that as of April, thereabout, when we were just about to go into a lockdown, and the state government was beginning to shut down things, they want to shut down the market, they want to shut down the churches. The notices that were coming out actually had the voices of the leadership of those groups.
Yeah.
So they talk about the market women's leader has met with the government and has therefore passed on a message to all the market women and all of that. And then somewhere along the line, that got lost. And all we were hearing was from the government, not from the leadership of those people.
Leaders.
Yes, so that you take the engagement deep down, sit with the people and say, look, we know you need to make money.
So we have dropped the ball at that point.
I believe so.
Because you would know that the conversation both of the president and of the PTF COVID-19, of the vice president and several others, is for the governors at the state levels to take the message of these protocols we're talking about to the locals, the local government levels, the traditional rulers, the community leaders, the sectional leaders that you're talking about now, the market women, the bus drivers, Okada riders, and the rest of them. So that was the advice. Perhaps that's when that happened. They were able to take it to that point. At what point do you think we lost it? And what are the consequences if we do not get back there?
The consequences are that, in Chinua Achebe's words, things fall apart. We must get back there, really. We have no choice. We must get back to where we sit with the different groups and we talk to them. We don't threaten them. We talk to them. We ask even their own advice that how can we sustain, life, as it were, in the midst of this challenge. Okay, you want to do your business, you want to do whatever, but this is the challenge. So how can you help us? You know, what would you suggest?
Yeah, Mr. Bassi, it is tough getting this conversation to the adults, the parents, the guardians. How do we advise children whose parents and guardians find it difficult lining up with these simple mechanisms? How do we get those children who are returning to school to line up when the elders are finding it difficult?
Yeah. Thank you so much I think we've set the scene for what the issues are. And we have an opportunity here. And I'm happy that we all on this program are speaking with the same voice. The issue here is communication and engagement. Engagement needs to be participatory. It needs to have a feedback mechanism, understanding why people are not doing things, not just the sciences driving why people are not doing things. Now, communication must be targeted. And as I said earlier, it must not just talk about the health issue. It must be interwoven, health, economic, and learning. So for children of various ages, you know, children that are, or would I say young adults who are at the transition class levels, you would want to craft a message that, look, it is important that you adhere to protocols because you need to transit onto university or your vocational center in 6 months. And if you don't adhere, you could fall sick, you could A, B, C, D, F, G, Y. For children at early learning, you turn it into music, into dance, into folklore. And a lot of the communication I have been hearing is in a lot of scientific and big man's English. We're not speaking pidgin that the market woman can talk to her son or daughter. You know, so whether a child is in a top school, international school in Lagos, or in a rural school, we start having disparate communication channels so that something is in Fulfude, is in Efik, is in Nupe, is in Yoruba, that it reaches the grassroots. And these are not necessary long things. It could just be a mantra. A mantra could be, you know, like wash your hand bin, sneeze bin, you know, something of that nature. And it's not complicated. We have communication experts in this country. We have content people. This can be done. So the answer to your question is that we cannot continue with a universal communication approach. Communication must be targeted to the various sectors, to learning, to health, to the economy. Communication must be interwoven. It must address issues at the mother tongue. It must address issues at, you know, sectoral, both informal and formal, because the issues are dissimilar. I just want to paint a picture to you. A parent in a highbrow school in VI, in Asokoro or Ikoyi, is more educated, has a different nuance to the understanding, and can say, okay, you know what, my child, I want you to go online because of this. So the approach to that parent and the communication material would be totally different from the woman who has to drop her child or whose child is going to school in the neighborhood, walking to school while she goes to the market. So we need to communicate. And like the gentleman has said, we shouldn't use fear and propaganda. We need to reassure people. And with the reassurance is where leadership comes in. And I believe that's what the PTF is asking state governors to constantly disseminate. And I think some state governments have done a fantastic job. I don't want to call out names, but some have shown leadership. We need to then ensure that that leadership comes to the household level. Because as we've said, we need to realize that we're in a psychological war situation. This is no longer normal. You know, it's really a constant daily battle, and we need to empower people by giving them the right tools of communication, and empowering them by engaging them, whether it's at the school level through PTAs, through SUBEB, sending jingles on radios, social media, TVs. That can be done. I'm not seeing anything that is addressing children on a pluralistic level till now. So we should use dance, poems, music, and, you know, simple mantras to drive the message to the younger groups, while a more salient message can be given to those at, say, SS3, SS2 who are in the examination classes. Thank you.
Now, Chooks, you are a parent. So how confident are you that your kids will be safe when they return to school on Monday? And how confident do you think other parents are, you know, And will they be ready to send their children off to school on Monday?
Thank you. My child, who is built to return to school, to the university, my last child, is watching this program. I have had a traumatic experience just finishing from SS3. They back and forth. She went back to school. They asked them to go home. Eventually, they went back to school, wrote WIEC, read. So, and as I was coming here this morning, we talked about her to watch. Now, what time she's going back to school also is important, because those that are already enrolled, I don't know when they are going to go back to class, take their lectures, write exam, pass, so that these new ones can enter. But she knows what to do. She knows what to do. She knows how important the protocols are. We just added something in my house recently where you have to put shea butter and mentholatum in the hot water and inhale it, because both of us have to go out every morning to go and look for something to eat, because she's free now.
They hustle.
They hustle. Every morning we'll go out, so we do that. I was not able to do that this morning before I came out. Now, she has to go to school. But above all, it's a faith thing. It's a faith thing as a parent. You have to have some level of faith that she will go and come back. Because really, this last section in SS3, it was basically faith. Taking her back to school and the school setting up the protocols when Lagos State government said schools should resume. And she went back to school, and she's back, and she's well. So it is the same thing. But any one of us here that is a parent, you know that really what you owe that child is to have faith that it is going to be well with her. Because you're not going to keep her in the house for a whole year.
Yeah.
And trust that other parents who are also sending their children to school will do the same thing. And that she will be so, with the self-discipline that she has from home, that she'll be able to use that to protect herself. Otherwise, she will just come back home. She knows what to do.
When we come back from this break, Dr. Do, you tell us your experience and what you're going to do with your children after this break.
Thank you for staying with us. Well, Dr. Odubanjo, the question she posted to you before we went to break. Would you agree with, Mr. Nwoko, that the thing to do is what?
Follow the protocols, display self-discipline, because we talked about homes and education at home. You got to do your job.
And then leave the rest to God.
Well, and expect that other parents have done their own bit. Okay. Because it's her job to say no. The other parents haven't done their job, or these children do not.
Because children actually have that thing. They will say, well, Mom, you are not supposed to do that because my teacher said.
My teacher said.
Yes. Okay. If other students do not show that self-discipline that she has, then it's our job to come back and tell me, and we'll take it from there. But majorly, my job is to constantly pray for her.
Okay. I mean, I can't agree with him more. It's difficult, and it's difficult for parents. Interestingly, I got a message, and my child's school said, my daughter's school said, they can do online or they go to school, boarding school. So I said, forget online, you are going to school. I said, because I want my life back.
Self-interest.
Yes, I mean, you guys I have to be assistant teacher, monitor this, monitor that. I said, no, you go. So that's also some degree of faith. Faith in the other parents. I haven't taught the children, because every time they go out with me, the first thing I ask them, you jump in the car, is where's your mask?
Where's your mask?
I mean, you're not going to wear it with me in the car, but where's your mask? Because we might stop somewhere or the other, and you're going to have to wear it to get into any place with me. So I expect that people have been doing that. I expect the schools have tried their best. But again, there's always a degree of risk, and that's where the faith comes in.
Mr. Forgive me if you don't.
Yes, you go ahead.
Mr. Bassi, children have been home for a while. So going back to school is like starting afresh. Many of them haven't picked on their books in like how many months now? And they're going to go back into class and pretty much start afresh. What are the things that you think teachers, parents, government ought to look out for in the psychology of learning?
Okay. So what you stated is not the general reality. Like I said, there's a divide. What the learning crisis has showed a great digital divide. So children from middle to upper class homes actually have not been left behind. They've been on top of their classrooms because of their schoolwork, because they have been connected digitally, and online learning has continued. And what we've seen is that online learning is not necessarily dissimilar in terms of learning outcomes. So the children from poorer backgrounds who were not able to catch on because they've not been able to connect to learning online and remotely are the ones who've suffered and have not been able to get that content. But on a whole, both children, irrespective of what backgrounds you're from, would suffer from that lack of social interaction. Children are encouraged, part of one of the basics of early childhood is to allow children to interact. And that interaction does a lot of things. It builds up the cognitive skills, communication, particularly for the younger ones between the ages 3 to 6, 7. That really helps at that stage. For those also going through hormonal things like puberty, you find that interactions help them to kind of reinforce and find their identity beyond working with adults and siblings at home. So for teachers, one of the things we have done for those companies and other, governments and consultants that run a massive programs of teacher training is to build the competencies of teachers to be more empathic, to bring in that empathy into the classroom, for the teachers to be emotionally intelligent, raise their EQ so that they know and are more aware. So while you find a child who's not doing as well as maybe he was doing last year, or a child who has suffered, a lot of people have suffered some sort of loss, whether loss of income, parents have lost their jobs, household incomes have gone down, and this has impacted them. So for teachers, it's important that you understand this. And the teacher himself or herself needs to be emotionally intelligent because they themselves have their own issues. So it's almost like we're dumping everything on this poor teacher in the classroom to solve the problem. But governments, parent-teachers association, old alumni of school, we need to build up the teachers to give them a voice of empowerment and the competencies that they cannot just focus on the subject areas, but also on the empathic areas. Now, the other thing I feel where government can really help, and I think this is where data is important. I think that we have an opportunity in this crisis to use data, big data. We call it small big data. That's big data in smaller tranches and targeted. We should see where the curve is showing. I mean, the learning curve is showing a lack of sufficient resource to support learning. Is it in mathematics? Is it in science? And those are programs that we could have remedial programs on TV. Whether it's Lagos State government that is doing a remedial program, it's on TV. You can access it in Cross River or in Borno State. So another thing is I find that all the state governments sometimes are trying to do the same thing. Perhaps with the National Council of Education, we can say, okay, if Lagos State are going to sponsor a program on STEM, let Edo State sponsor a program on arts and culture. Put this program on national network and radio network, and then people can access it globally. The other thing I feel we should really do, and this is really addressed at the Minister of ICT, who's a very progressive gentleman, is we need zero rating for tertiary so that we can really have affordable e-learning and for low income. So people who are accessing any form of learning, maybe over the next 6 months, can be supported at home. So you find that at the lower end, people can't afford data. Can we make that free, that people can get data, can just have access zero-rated bandwidth to access learning? So those are practical solutions that can help us succumb this issue for the returning students, both by the teacher in the classroom, by the government, and the stakeholders. Stakeholders, you have a role to play. PTAs, it's not just about school fees. You need to be part of the enforcing of these protocols. PTA association, community-based neighborhood watch association. We need to be a brother's keeper. Particularly, sorry, I keep saying about low-income households, because these are where we are seeing a lot of issues. Are you looking after your neighbor? That child coming back from school, that is coming back later than normal, have you found out what is going on? You know, we are seeing a lot of suicide, depression. This is a mental health. So teachers, stakeholders, you need to watch out for other things. It's not just about the academic performance. You need to look into the child. You need to look into that teenager and that young adult to see that have they changed. And there needs to be more communication in classroom, not just what do you understand? Let's get to the bottom of how do you feel and kind of drive that through. And again, stakeholders, mosque, religious groups, mosque, Christian groups, we should do this as much as possible through our Sunday school, through our young people's network. We should really, really try to work this through and not leave everything for government and the teachers in the classroom to observe.
Yes, Annie, I hear you, and I hear you very clearly. But it's one thing to have internet access, but you also require an equipment into which you're going to input that internet access. So in the rural areas, how are they going to get computers? And even in the urban centers, there are public schools, there are more public schools than there are private. How are they going to get tablets or computers into which you're going to feed them this free internet access?
Okay, so Alera, fantastic question. There are many ways to support online learning, but I'll start with what I shared earlier. We can use WhatsApp to teach it. We're using it in Nigeria, we're using it in parts of India and in parts of the emerging world. We're using WhatsApp to teach for feedback and homework and peer-to-peer learning. It's working very well. But what you find, and most Nigerians typically, let's be honest, a large percentage of people, growing numbers, have second-hand smartphones, but they don't have access to continuous data. So they use data quick on Facebook, it's gone. So that's where we need to, that zero rated could help out. Now, when you mentioned the rural areas, I want to say something about radio. Radio is very efficient, it works well. In northern Nigeria, every single household has an access to a transmitter radio. It works fantastically well in rural areas, and the communication is effective. So FRCN can be deployed. And lastly, I think this is something the PTF should really address. PTF should start looking at technology solutions. You know, we are so focused on the problem that we're losing the opportunities here. Can we have solutions from entrepreneurs, social entrepreneurs, individuals? You know, let's even create a portal and get people to bring their ideas forward, ideas of how to surmount issues in employment, healthcare. And, you know, those are areas where the government can easily scale up. I just want to throw a very controversial conversation here. When we talk about vaccination, and I looked at the amount of money going to spend on vaccination, I found it boggling. You know why? Because till now, we don't even know if the vaccination is foolproof. So why would we spend huge amounts of money to vaccinate when we don't even know if they need a top-up vaccination in a year's time? Surely 500 billion, 400 billion, 300 billion, because we looked at it at about $8 per vaccine and about 200 million Nigerians, which has never been contested or proven. If we spend that money in our healthcare, primary healthcare, trust me, things will change. If we even push a bit of that money into little things, rather than putting funds to vaccinate people where we are not sure, people that we're even vaccinating, we are told that after vaccination, you still need to wear a mask to school, you still need to adhere to all this social distancing and protocol. So those funds, I don't think we should even be talking about vaccination. We should divert those funds to things like targeted communication, empower every single Nigerian, whether you're going to school, you need to get a job, to make a decision for yourself at the household level. And then to give you basic tools. We know there's no money in the world. We know that Nigeria doesn't have money at the federal level and at state level. So let's be real and practical, and let's be more efficient on how we throw money at problems. So in a nutshell, Alero, we can use zero rating in a plethora of ways. Zero rating for those who have WhatsApp, Facebook, a lot of Nigerians on Facebook. And then the radio can support what we call instructional radio instruction. When the lessons are done, even the parents who may not be very literate can therefore assist their children in homework. We can also encourage smaller neighborhood group after-school clubs, 5, 6 people, because these children anyway are playing together, to learn. And in all of this, we keep reinforcing, wear your mask. We put the song when it comes to maybe a commercial break.
Annie, sorry to interrupt you. Sorry to interrupt you. You keep talking about WhatsApp. To be able to use WhatsApp, you need at least an Android phone. No. The data is coming for free. That's what he's suggesting.
If the data
but
comes
you
for
need
free.
the Android phone to be able to use the data. An Android phone doesn't come cheap.
Yeah, and I actually was in an office where someone wanted to give the person a number and say, look, do you have your phone? Let me give you my number. And the man says, oh, no, I don't have any phone again. All my phones are with my children. They're using that to learn. And it struck me. This was a middle-class person. And it struck me how difficult it was for him to get even his children to do the online learning. But I think that's why he's talking about, this has to be mixed methods, radio, and all, but everything has to come together.
Yeah.
There's something else that Mr. Basia, you mentioned, which is, square your purview, Dr. Okubanjo, and that is the mental health aspect.
Right.
I had a shocking revelation, I think about going to 2 years now, where we had a guest who said that mental illness starts from as young as sometimes 10 years old.
Even younger.
And what was the disease? It said depression. 10 years old.
What is depressing a 10-year-old who has no bills to pay?
Exactly my question.
Environment.
My question.
What is depressing a 10-year-old, please?
Even you're depriving them of TV time could be depressing. But the point is to note.
But so now that is out there.
Right.
So clearly, and that's what I was trying to reference in my, in the question, posted to Mr. Basia the other time. These children are literally in a mental health state now because they have been denied the access of social inclusion that he referenced earlier.
Right.
Now, transiting them from that state of mind to the learning environment,
mode.
To the learning mode now. That's the thing that I think we should be paying attention to now. Do you see us, even factoring that into this announcement of returning them to school?
Well, not enough, but I think he addressed that very nicely, which is that you need the teachers to be on board, where emotional intelligence is concerned.
That is, if the teacher himself is not depressed.
Yes, and even the parents, because like we say, okay, what depresses such a child? I'm sure we've heard a child or two before tell you, I don't think my parents love me. And the mental...
But children go through that phase where they believe their parents don't love them because they're being disciplined and they think the discipline is too much.
I agree, but the error is to dismiss it completely without actually weighing it, looking at it a little bit, thinking about it a bit more, and sometimes interrogating the child. If you dismiss it completely and don't, you'll get over it, that would be the error. Because not every child gets over it. Some build upon it and actually have been known to commit suicide.
So what does a parent then do?
You have to take the time to understand, okay, what is the problem? Why would you think I don't love you? It takes a bit of time. Oh, yeah, you beat me all the time. You are too. And mind you, that will happen perhaps even more now. Because when they're at home, the parent also is stressed. He's thinking about income and blah, blah. So you get edgy. And sometimes you might take it out on the child. And the child is feeling that, that stress, that anger, and is wondering, am I COVID? Am I the virus?
Now, Mr. Awoko, I was just going to ask you the question about the parental angle of that conversation. The parent is already having pressure. Please, irrespective of what the social position of the parents in the society, every level of life, at every level of life, we have different challenges that we have to contend with, and all of that. So, in this space that we are talking about now, the parent is also having something that he or she is dealing with, and has to factor in, pretty much step your own case down to address that of this child, while you are thinking about the economic challenges, the delicate balance of life and livelihood, which may or may not have been lost. How do we go about this?
Very interesting. something happened yesterday, and this morning I took it to another level. I went to YouTube and I played this song while we were having a quiet time this morning. And I played the song, Let There Be Love. Let there be love among...
Shared among us.
Let there be love shared among us. Very, very important. I've been talking about love, between me and my kids. Because of little things. In health issues, when you get a certain age or a certain level in your life, you're concerned about your health. So you're seeing your doctor, you're taking care of this, you're taking care of that. One of the things we have overlooked over the years is the environment. I just realized yesterday, we were in a hurry to get out yesterday, so we didn't really dwell on it so much. But this morning I played that song because you needed to just create an environment of love. When I used to go to Pentecostal fellowship or whatever, that was when I used to hear. Yesterday just came back to me that we need to just share, not just, we actually needed to tell each other that I love you. Say it back to me and all that. That's what I have done. And I think that if you have done everything well in your own house, check the environment where you're doing this thing that we're talking about. You need to create a conducive environment where love is expressed, where forgiveness is key, where eating together, putting it in a table and putting the food there and eating together is very, very important. Because like I said, if I was a political leader here, what I would say to my people every morning and every evening is do whatever you can. For me, I'm trying to do whatever I can. And I think that that's the level of leadership that I'm able to provide. I don't know the one that you're able to provide. But we were talking earlier, and I said to you, what you've done to the people who came to your door was leadership. Even if it were just one person, when you challenge them and question them about their mask. Now, you know that in the street, people don't believe in this thing. So we provide the leadership. It doesn't matter how they feel and all that. A lot of people, my neighbors, a lot of my neighbors in the street, they tell me when I wear my mask and I'm saying hello to them, say, why are you greeting us with your face covered? Are you carrying this thing? But it's our duty to provide that environment also. So it's very, very important that we create a conducive environment, having done all that we have been told to do. Wash your hands. By the way, I always say this, in 2003, when SARS broke out in Hong Kong and in China, all they did was just follow the protocol. So people ask and say, oh, they recovered quickly. No, they worked on the experience of 2003.
But in agreement with what you said, these are trying times for everybody.
Absolutely.
And we always have said on this program, because you can't go visiting people, it doesn't mean you should forget about them. Reach out to someone, call someone. How are you doing? How's your family? That may be the highlight of their day because they've had a very bad day coping with children who haven't gone to school, giving them stress in the house, and you will just be some bright light in their day just by saying, how are you all doing? So just your family alone, Chooks, is not enough.
I
Reach out to somebody else and make their day.
Absolutely.
Thank you very much, gentlemen. Starting with Mr. Annie Bassi-Eyo, who's co-founder Axiom Learning Solutions, who joined us via Zoom from London. Thank you. And we had in the studio Mr. Chooks Nwoko, social entrepreneur, as well as Dr. Doyin Odubanjo, Executive Secretary of the Nigerian Academy of Science, Stroke. He's also a public health physician. Thank you all very much for coming to share your thoughts with us this morning.
Absolutely.
Sunrise will return in just a moment, and we shall be still talking about COVID.